bacterial infection, we will have an overview about the antibiotics, because the common antibiotics, their mechanism of action is a very common area from lot of question comes, especially in the MRCP Part 1 exams. And we'll see an overview of the antibiotics. Then we will see some gram-positive bacteria which are important in the UK perspective, then some gram-negative bacteria, and we will see Mycobacterium tuberculosis along with the other infections. So first coming to overview of the antibiotics. It's a very short topic but very important topic. We are just going to discuss about the mechanism of action of different antibiotics, which can come in question, like it can be a direct question. What is the mechanism of action of vancomycin? They can ask you directly, or they can indirectly ask in another way, like which of the following statement is wrong. There may be one statement which relates to the mechanism of action of a certain antibiotic, and that statement can be wrong. If we are not exactly aware of the exact mechanism of action of the antibiotic, we may get that question wrong. So this is a short topic but can fetch you marks. So based on the mode of action, antibiotics are classified into basically three: cell wall inhibitors, nucleic acid synthesis inhibitors, and protein synthesis inhibitors. The cell wall inhibitors can either target the peptidoglycan layer or the inner cytoplasmic membrane. The second one will be nucleic acid synthesis inhibitors, and the third one is protein synthesis inhibitors. First, coming to the cell wall inhibitors, their target can be either an enzyme involved in peptidoglycan synthesis. This is the first group of cell wall inhibitors which inhibit an enzyme involved in the peptidoglycan synthesis. So which are the antibiotics which inhibit the enzyme involved in peptidoglycan synthesis? Any guess? Hello? Hello? Any guess? The antibiotics which inhibit the enzyme involved in peptidoglycan synthesis. Hello? Okay, so I think Dr. Palas has joined. Okay. So the antibiotic which target the enzyme involved in peptidoglycan synthesis, they are the beta-lactam antibiotics, which include penicillins, cephalosporins, and carbapenems. So they are the beta-lactam antibiotics. Their target is enzyme involved in peptidoglycan synthesis. Specifically, the enzyme name is transpeptidase. So beta-lactams inhibit transpeptidase. Now, we have another group of antibiotic which binds to the terminus of the growing peptidoglycan on the outer surface. So if you see, if you can see that if we consider the dark green layer as the peptidoglycan layer, and there are certain antibiotics which can bind to the growing end of the peptidoglycan layer on the outer surface, not outer membrane, outer surface. So they are the glycopeptide antibiotics, which include vancomycin and teicoplanin. Glycopeptide antibiotics, again, cell wall inhibition by binding to the growing terminal of peptidoglycan chain. So both these groups, beta-lactam and glycopeptide, act on the peptidoglycan chain. One inhibits the enzyme, one directly binds to the growing terminal on the outer surface. Now we have a third group which targets the inner cytoplasmic membrane and does not affect the peptidoglycan layer. They are the polymyxins, which include colistin and polymyxin B. Both colistin and polymyxin B are grouped under the group of antibiotics known as polymyxins, and they directly inhibit the inner cytoplasmic membrane. So these are the cell wall synthesis inhibitors. Okay, is this making sense so far? Hello?
Yes, sir.
Okay. So now coming to the difference between beta lactams and glycopeptides. What is the difference between the action of beta lactams and glycopeptides? And one acts on the enzyme and one acts directly on the growing end of peptidoglycan. And now if we see the structure of gram positive and gram negative bacteria, one thing we can see is gram positive bacteria has an outer surface made of peptidoglycan. Gram negative have a distinctive bilipid outer membrane and the peptidoglycan is not exposed. So the first picture shows the gram positive bacteria with an exposed peptidoglycan layer. The blue colored balls are the peptidoglycan chain. So gram positive bacteria has an exposed peptidoglycan layer. Whereas if you see the structure of gram negative bacteria, after the peptidoglycan layer, it has an outer membrane made up of a bilipid layer. You can see that. So what will be the difference between beta lactams and glycopeptide antibiotics based on their efficacy against gram positive and gram negative bacteria? I will give you one more clue. Beta lactams are small molecules and glycopeptides are large molecules in comparison. So how they will differ in action against gram positive and gram negative bacteria? If you have an answer, please raise your hand. Otherwise, I'll continue. Okay. So since like I told, glycopeptides are large molecule and they cannot directly bind to the peptidoglycan chain in case of a gram negative bacteria because there is a outer membrane. So glycopeptide antibiotics are ineffective against gram negative bacteria. This is one take home point you have to remember. Glycopeptide antibiotics are ineffective against gram negative bacteria because they are large molecule and they cannot directly come and bind to the peptidoglycan layer because there is an outer membrane, whereas they can directly bind to the growing peptidoglycan layer in the outer surface of a gram positive bacteria. So glycopeptide antibiotics, they are active against only gram positive spectrum. Okay, whereas beta lactams are smaller molecule, they can enter the uh, gram negative bacteria through porin channels and inhibit the transpeptidase enzyme. So beta lactams can be effective against both gram positive as well as gram negative, whereas glycopeptides will be active only against gram positive bacteria. This is one thing you have to remember. This has been asked in one of the exams. That's why I specifically wanted to mention this point.